Hello. I want to thank all of you again for joining us so we can do this virtually and get all the information we need to get out to the people of Jacksonville. With me on the call today are Sheriff Mike Williams, Fire Chief Keith Powers, and Director Steve Woodard from our Emergency Operations Center. This morning at 8 a.m., my executive order took effect requiring employers to allow employees to work from home if their job duties can be performed from home. This is exactly what the order does. This allows any employees who can perform their job duties from home to be able to do so. Employers must allow this if those duties can be performed from home. If an employee is unable to work from home, they should be no less than 6 feet away from other folks. This is a social distancing measure that is supported by medical experts as a method to reduce infection rates. Look, we are all in this together, and I understand that every business is different and has different circumstances. But now is the time to act to flatten the curve and stop the spread of the virus. Employers and employees work together to make this executive order work. Sit down and figure this out. Obviously, when you talk, be 6 feet apart. Sit down and figure out, can the job duties be performed at home? Both sides be reasonable. And if they can, work from home. If they can't, be 6 feet apart. This may require employers to adjust their business models, and by no means should this be used by an employee to stay home unnecessarily. If their job duties in fact require them to be there, they should be at work at 6 feet apart. But let me be very clear about this. I'm very serious about this executive order, and I'll use every executive function of my office to enforce this order if I have to. That includes condemnation and subsequent termination of utilities to businesses that refuse to cooperate during this public health crisis. These are not measures that I want to utilize. So I'm asking employers and employees to reasonably figure out if the job duties can be done from home. If they can, allow it to happen. If they can't, be at work, be 6 feet apart, and practice social distancing. Another method to fight the spread of COVID-19 is to increase testing so we can better target and isolate those who've been infected. And we're doing that here in Duval County. In just 4 days, our drive-through COVID-19 testing sites at the Prime Osborn Convention Center and Lot J have tested over 1,100 people. We should start seeing results soon, and we'll share that information as we receive it. Our federal testing site at Lot J will continue to be open at 9 a.m. daily and operate to 5 p.m. or as supplies last. To conserve supplies and avoid overwhelming testing facilities, Health and Human Services has directed that the number of tests available each day be capped at 250. I've been asked by members of the media if I've been tested for COVID-19, and I've not. And that's because I'm following the advice that I'm providing to you, the public. I don't have any symptoms. No one in my family has symptoms, and I've been practicing very disciplined social distancing. I've been practicing all the hygiene efforts we've talked about. We must do this so the testing and the supplies that our public health workers and doctors and nurses have to use are not unnecessarily used on people that aren't symptomatic. So if you're not showing symptoms and you don't fit the criteria, you don't need to get tested. Tests should be reserved for those who are symptomatic. At this time, none of those around me, my family, or my administration have symptoms, and no one that I've come into contact with in the last several weeks has tested positive that I'm aware of. With increased testing, we fully expect a number of positive COVID-19 cases to increase in Duval County. But judging the severity of this virus based on positives is a very misleading data point, because that's not a statistical sample of the population. It's an isolated sample of people that are symptomatic. Comparing positive diagnoses by county, it doesn't tell the story. The data point that I'm looking at and paying attention to are hospital admissions from this disease. Watching what the admissions look like as a result of COVID-19, and those would include cases that are severe or critical. The goal of all this, of testing, social distancing, and executive orders, is to reduce the spread of COVID-19, flatten the curve, and lessen the impact of this pandemic on our medical system and the community at large. The goal is to prevent the circumstances we're seeing in other countries, where hospitals are full and critical needs patients are going without the care they need because of the lack of resources. We'll continue to have regular discussions with our area hospitals. They're in good shape currently and are not at capacity. And we hope that this doesn't spread widely in Jacksonville and fill up our hospitals. But hope is not a strategy, so we have to plan. At yesterday's briefing, I talked about a federal field hospital that will be deployed here in Duval County. It will be located at the Prime Osborn Center, and setup will begin today. As I said yesterday, this is only a precaution. We're getting ahead of what could happen. Our hospitals are in good shape. This is an asset we will have in our region to use if needed. Director Woodard is on the call and can address this hospital as when we begin to take questions. While many of us are isolating at home with our families, many are out there working to keep us fed, take care of the ill, and keep our country and our city running. I want to thank the folks who work in grocery stores, convenience stores, hospitals, doctors' offices, transportation, news media, public safety. There's so many more. There's a short list here of many who are sacrificing on behalf of our community. Take a moment today to say thank you to those who are working so diligently to help us through these unprecedented times. Among those still working include many men and women in Jacksonville and contractors that provide essential services. Even though many of the resources and conversations we're having are around COVID-19, as they should be, and our response, our teams are continuing to collect garbage, waste, recycling, keep our city moving. Critical public infrastructure projects will continue under new safety guidelines. So I want to thank all of those workers for their work. Our solid waste crews are taking necessary precautions to reduce their risk, including sanitizing their trucks. We have moved all of our 630 city customer service call center representatives to work remotely. Starting tomorrow, all city departments that have lobbies where the public can interact with city employees will be closed. Affected city departments will provide contact information with door signage on their website so essential operations can continue. If anyone has any questions about these closures, you can always call 630 City. The men and women from the Jacksonville Sheriff's Office are also continuing what they do every day, and that is working to keep us safe, to fight crime, and to make sure that we're all protected. So to talk more about that, I'd like to turn this over to Sheriff Mike Williams.
So thank you, Mayor. I also want to echo the Mayor's comments on specifically for us, thanking the men and women of JSO and our colleagues in the fire department. We're out there doing the work that we've been doing every day, and now dealing with the virus on top of that, and they've done a tremendous job in that. Just briefly, the Mayor and I spoke this morning, just talking about crime numbers in general. And although it's early in the year, our overall crime numbers are up about 4%. Nothing to be alarmed about. These will go up and down throughout the year, but something that that we track obviously on a daily basis. We're also showing a dispatch calls for service number that's up about 4% year to date. Really, nothing in the numbers are super alarming at this point. Again, it's early in the year, but one thing that we have seen and we've noticed is we have not seen a decrease in activity since we've been dealing with the COVID virus. So, while we are obviously making some major adjustments to deal with the virus, the other duties day to day in terms of crime fighting have not stalled. So we're continuing to shoulder that load every day as well. But again, I want to take a minute and thank the men and women of JSO for their tremendous work over these last couple of days. There's been a lot of conversation about our correctional facilities in the last few days. I do want to say that at this point we have no COVID-19 virus positive inmates in the jail at this point. So we've done a lot in the last several weeks. Keep in mind that we stay really in a posture of infectious disease, fighting infectious disease posture in the jail constantly because of other diseases, TB, HIV, things that we deal with on a regular basis. So ramping that up to deal with this current virus was an easy step for us. So we've done everything that you've seen in terms of the CDC recommendations for correctional facilities. Those have been accomplished here as of a couple of weeks ago. So we continue to monitor that. But again, we have nobody currently in the jail that has that. We anticipate maybe getting a case, and we're ready to obviously deal with that when that happens. And we're obviously partnering with the health department in those areas. But as of now, no confirmed cases in the jail. We are down 7 corrections officers that we have quarantined just based on potential exposures. And we have some tests pending with some of those corrections officers. But other than that, not a big impact to the corrections workforce as of yet either. And in terms of the law enforcement patrol and investigations workforce, we've lost about probably 20 some odd people. They're at some level of quarantine. Some of that's based on personal travel. Other cases are based on exposure. But at the end of the day, that's less than 2% of our workforce. That's a number that we monitor every day. And so we feel like we're in good shape there too. Again, lots of conversation internally about the universal precautions and ramping things up that we do here to keep our officers and obviously their families safe. So with that, I'll turn it back over to the mayor, but I'll be here for questions after.
Thank you, Sheriff. Before we take questions, just want to speak for a moment about taking care of each other. First thing I would like to ask that, look, everybody's working hard. I mentioned healthcare workers, grocery stores, just so many people working every day hard to get us out of this. And we're going to continue to do that. I would ask, if you're a person of faith, pray for our city, pray for our people. I want us to just think about each other and in ways that we could connect. As I said yesterday, and it's worth repeating, our routines in our lives have been completely disrupted. And that's incredible stress on people, not just financial, but mental stress, mental health stress. So I'd encourage you, if you're home every day, get a routine, get up and get moving, have some activities planned, connect with people. Pick up the phone, call them, talk to them, listen to them, share with them. Talk about something other than COVID-19. Talk about an old memory. Talk about what you plan on doing at some point. In fact, to that end, I'm asking everybody in our city tonight at 7 p.m. to pick up their phone and actually call somebody that you care about and just have a conversation about something that will put a smile on your face, and to be heard and to listen. So with that, we'll take questions. Jeannie Blaylock, First Coast News.
That's good. Thank you very much for taking my question. Let me back up so we can get this on the screen here. It's a new method we're all getting used to. So we'd like to ask you, Mayor, about the status of hospital beds in Jacksonville. How many do we have? How many ICU beds do we have? And how many are open at this point? And if you don't have those numbers, is that because the hospitals are reluctant to give that information publicly? Because we've been asking, we think that's important information for people right now, and we have not been able to obtain those numbers.
I'm going to turn that over to Chief Powers, but I will tell you that they've not seen a spike in hospital admissions, severe critical, as it relates to COVID-19 at this point. And the field hospital that we're setting up will have real capacity. With that, Chief Powers, if you want to take the question from there.
Yeah, thank you, Jeannie. We monitor here at Fire Headquarters in the EOC. We monitor from the live data from the hospitals. It lets us know how many ICU beds are available, what percentage are being used. I don't disclose that information, obviously, because it belongs to the individual hospitals. But I can tell you that we're nowhere near capacity right now within the city, and we're monitoring that on a daily basis, on an hourly basis, actually. And if we see the need, in an area where we need to make some adjustments, we'll get with the appropriate hospital and start making those adjustments. And that's where that field hospital that we're setting up at the Prime Osborn is going to come into play.
Jim Piggott?
A little bit following up on the hospitals. Can you talk about the convention center site, Chief? Are they setting up? We're not seeing activity there. And I think it's important that you mentioned, are they just going to be using that as a staging area for now, or what will be happening?
Okay, Jim.
Chief, I'll let you take it.
Jim, they're going to start setting that hospital up in the Prime Osborn sometime today. There was some logistical stuff that had to happen inside the Prime Osborn before we could actually start moving equipment in. So later in the afternoon, you'll start to see a little bit of equipment moving around and getting set up. And that's going to take us approximately, or the team that's setting it up, approximately 72 to 96 hours. There's also some pieces that we have to work through with our partner hospitals. And once we get that up and running, we should be able to open the hospital.
Sky?
Hey, Mayor, I just have a quick question on how will this be enforced going back to your executive order? If an employee says, I don't believe I should be conducting this work at work, would they call JSO? How is this going to be enforced?
Well, the first thing I would ask is, look, for employers, employees to just work together on this. Have a reasonable discussion on this. And to employers, if the individual can work from home, they need to be working from home. And as I said, I don't want to use this enforcement tool, but I'm prepared to if I have to, which includes condemnation. We could slap a condemnation notice and then we can shut off the utilities. We don't want that to happen. We're all trying to protect each other. I talked yesterday about being a helper. So what I'm going to ask right now today is those employers and those employees have a reasonable discussion about what can be done from home and what can't, and then be smart about this and take these actions so we can be safe. And if you have to be at work, be 6 feet apart. Scott Johnson, WJXT.
Yeah. Yes, Mr. Mayor, to follow up on that, we've gotten dozens of reports of businesses that are open, keeping employees there. It's hard to determine what's viable and what's not. How would the city go about that? If you get calls, if this business is operational and maybe it is or is not viable, do you send in inspectors, or do you have any idea of the mechanism you would use to go in and make the determination if you need to condemn a business or turn off utilities?
If I continue to hear that there's not compliance, I'll use all the resources available to me to identify those situations. And as I said, the power of enforcement is condemnation. Don't want that to happen. I'm going to go back to this. This is a time for us to care for each other and do what we can to stop the spread. And so I understand the executive court order comes out and businesses are scrambling to figure out who can work from home, who can't. Employees are trying to figure out if they can or can't work from home, and it went in effect at 8 o'clock this morning. All right, so let's take a deep breath. Both sides, let's just take a deep breath. And we're not going to charge your building right now, but you got to figure this out, and you got to figure it out fast. Have a reasonable conversation and do the right thing. Elizabeth Pace, Action News.
Hi, Mayor Curry. One was about enforcement as well. Is there a hotline, or should they email the city directly? And two, previously you've talked about a curfew. Do you still plan on any plans in the works to establish a curfew?
To your first question, anybody that has any issues on any subject in our city can call 630-CITY, which is our call center, which, as I mentioned before, as an example to employers, we have figured out how to make that call center where they're not in the office. They're taking those calls outside of the office. And so, I'm sorry, the second question was curfew. Look, the sheriff and I have talked about it, and look, they are deploying their resources every day to keep this city safe, and don't want to have to put a curfew in and have to use the sheriff's men and women to enforce that. But it's a conversation we're having. And Sheriff, I don't know, you might want to kind of add in on the curfew question in terms of we're discussing it, but we got to make sure your resources are used efficiently.
Yeah, that's correct, Mayor. So in terms of the curfew, as the conversation the mayor and I have been having, there would be a lot of exceptions to that curfew. Going to work, people walking their dogs, people going to, purchase food. And so there's a lot of challenges with that. And in terms of resources, as I just mentioned before, our normal duties every day, our calls for service in this community have not stopped. And so we've got to be really, really measured in how we add things to our plate, basically. So, but again, as the mayor said, this is about the community working together. At some point in time, we have to take responsibility for what we know is the right thing to do as a community. And if that's to stay home, then we need to stay home. We talk about limiting unnecessary travel around the city. We should be doing that. We should not be having large gatherings. We should not be having house parties or barbecues at this point. There will be a time for that in the future. Right now, we need to shut all that down, as the mayor's asked and said over and over again, and really ride this out, until we see some progress here. So, we don't want to be in that posture. Obviously, we have the legal ability to do that, and we've discussed that in depth, obviously, with the mayor. But at this point, we're just asking for people's cooperation, and we seem to be getting it for the most part. You still have pockets of people that really, maybe from time to time choose not to cooperate, and we can at some point in time address those individually. But right now, I think we're in a good posture as a city. But we've got to stay on top of that. We've got to keep reminding each other to be cooperative in this environment and cooperate with the the orders of the mayor. Or we can talk about curfews, and again, that's something that the mayor and I talk about every day.
Thank you, Sheriff. Lou Turner, First Coast News.
Thank you, Mayor. So we've taken a handful of calls here. I've had a couple just here in the last hour of people who are like super worried about their own place of employment where a coworker has tested positive. In some pretty big places here around Jacksonville too. And I just would like to hear what your advice would be to those individuals who work at a place where a coworker has tested positive. What would you say to the employee who's called us nervous, who's hopefully watching right now, and that employer? Like, how should they continue with all this?
Here's what I believe based on what medical experts have told us. If you have been in contact with somebody that's positive, you have touched them, you have been in close space with them. First of all, the person that's positive needs to be self-isolated right now, away from people. If you have been in that close contact, very close contact, handshaking, I think that person ought to self-isolate as well, because it's likely they're a carrier. Or possible they're a carrier, I should say. Jeannie Blaylock.
Thank you for calling on me again, Mayor. We're getting a lot of discussion on our social media and calls about the beaches. So let's talk a little bit about beach closures. You explained very thoroughly why you were closing Jacksonville, Neptune, and Atlantic Beach, even explaining when it's high tide, it's kind of like ants on a hill. Yet the beaches in St. Johns County are still open. Have you personally made a call to, say, the mayor of St. Augustine or the county commissioners and say, come on, y'all, get on board. Please close your beaches as well?
I haven't. And here, look, each community is unique and has to make their own decisions based on if they think they can find a way to get people on a beach and social distance. I've talked about it with the beaches mayors, and it just doesn't appear to be a solution. fact, I talked to Jack's Beach mayor this morning about, is there any way to get crowds that are controlled, small crowds in these big public spaces? And the reason the answer is no is because of if you get, for example, 10, a bunch are going to show up and you just can't control it. So we took the measures we had to do to keep people from socializing in close spaces. I would encourage other counties to take this seriously and take actions necessary to make sure that you don't have groups of people that are in close contact with each other. Mike Mendenhall, Daily Record.
Can you hear me? Mayor, just in regard to the last clause in the executive order talking about employers making sure that they continue to pay their employees during this crisis. How do you enforce something like that? That is seen. Would it rely more on whistleblowers to do that? And then second question. In regard to city policies helping these businesses, you mentioned yesterday that those policy changes could be coming soon. What are those going to look like?
Well, to answer the first part of your question, again, the power in the executive branch that I have is the condemnation power that I don't want to use. But I don't know that I even needed to put that last part in, because if an employee is at home performing their job duties, obviously an employer has to pay somebody that's doing their duties. So we added that in for clarity. And then I'm sorry, what was the second part of your question?
Yes. In regard to your comment yesterday that your administration was drafting policies to offer some type of benefit for local businesses, what will an outline of that policy look like, and when do you expect to roll?
It's premature to, it's right now it's the theoretical discussion that we need to hammer out, and that we're also going to talk to some folks in the business community to make sure that we're getting input, obviously, by those that are impacted by this. So I would just say, stay tuned. Jim, JXT, WJXT.
Mayor, people, they're afraid, they're scared. We're getting those calls constantly. They're scared about the nursing facilities here. We're hearing Jacksonville has some of the highest rates in the state now. What can you tell us about these facilities, particularly the Deerwood facility? And overall, people even in line getting tested are calling me saying, they've been sitting there for 3 hours now at a time, and they don't know what to do, and they're afraid they're not going to get in today. What do you want them to know?
Well, I'll flip it to Chief Powers in a minute to talk about the nursing homes. In terms of the testing, we are, with our federal partners, we're testing at the capacities that we can to make sure that we don't overload the labs. That's just the facts. That's just where we are. The good news is we got our testing sites up and running before many, and are going to continue to do that. If you're symptomatic and you meet the conditions, which is 99.6, the temperature and respiratory issues, please go to the testing site. And before Chief Powers talks with specificity about the nursing homes, I understand the fear. I understand the concern. But we are all, every single one of us in this community are all in this together. And we have to look at the facts that are in front of us and make decisions that are going to keep each other out of harm's way. And the way to mitigate the fear is for us to all act responsibly. That is for employers to work with their employees and employees to work with their employers on the executive order. And if people can work from home, work from home. Socially, practice social distancing, to not travel unnecessarily around the city, go for some groceries or supplies that are absolutely necessary. Don't go to block parties, don't go to a friend's house and socialize with a bunch of people that have come from other homes. Just be responsible. And that's the way we flatten the curve. That's the way we take care of each other. And that's the way we just have to act. With that, I'll turn it over to Chief Powers on the nursing homes.
Jim, as it relates to the nursing homes, we take those very serious, and our state partners have come in with us. We have established incident management team out there that is working with the nursing homes in not only Duval County, but Clay County and Baker County as well. And those teams, we take it so serious that one of the senior members of the mayor's staff, some of my senior staff, is assigned out there helping, making sure that we're on top of this. And they're looking at all the nursing homes and making sure that we have those areas. If we identify a problem, that we're addressing them and trying to help those nursing homes get to where we can rid them of the coronavirus.
All right. Well, I appreciate, again, all of you that are covering this and sharing information with the public. Again, I want to reiterate, let's be a helper to each other, but stay 6 feet apart, 6 feet away or more from each other. And remember that I asked, it's 7 o'clock tonight. Let's all get on our phone and actually call somebody and listen to them and share with them about something other than COVID-19. Thank you.